Hey guys, Steve Williams and my partner,
Dr. Wasicek.
Phil Wasicek here. We're just going to answer some questions about whether things are too hyped or not too hyped. Is that a good way to say it?
Yeah, what's good, what isn't?
Yeah, I want to go first. I'm going to talk about thread lifts, particularly because I just had a patient who had thread lifts done and she had an injury. So I'll talk about it. Generally, thread lifts are a way to kind of avoid getting a facelift. You kind of put these strings in and they kind of pull things up. The old thread lifts were actually taken off the market because they were just found to be too dangerous because people had asymmetrical faces. They looked like they had strokes. It was terrible. The new generation of thread lifts is designed to go away eventually and leave a little bit of residue that gives you a little bit more structural support. Generally, it's not powerful enough, and it's still a little bit dangerous to put them in. My patient that I referred to a second ago actually had a parotid injury. They actually went through her parotid gland and she had a big parotid cyst we had to manage, and ultimately we did a facelift on her because that was what she really needed anyway. And so I'm not a big fan of thread lifts.
I agree, short-lived, usually not. You want long-term results. You don't want to go through all of this.
Especially for the risk.
Yeah, that lasts for maybe a month, maybe two.
And when it starts to go, it still does this, and which is a little bit odd.
So threads are out. I guess my turn.
Yeah.
One thing that I hear sometimes from patients and they ask frequently is with filler, they feel like they can get a facelift, or people tell them that
liquid facelift.
Liquid facelift. Yeah. And they have a lifting effect with filler. And that is just so wrong. And I feel like it's just throwing money out the door. You want effective results. It's just disingenuous of what filler can actually achieve. Filler is amazing, but you just have to realize what its uses are for. And in general, it's for volume addition. It doesn't actually lift or tighten per se. And so you have to be super careful about that if you're thinking about that.
Yeah, it's the right tool. I think as people age, they can lose some volume in their face. And so you're not really doing a lift, you're replacing the volume that they've lost. And that can be aesthetically pleasing, but it's not the same thing as a facelift. I agree with you. All right, I'm gonna do one, skin tightening. And this is a controversial one because there's so many devices, there's so much talk. I'm not gonna name the companies or the devices, but you know what I always tell patients that come in and say, well, just do liposuction and then do the skin tightening thing, is if those devices were really as powerful as sometimes is claimed, no one would ever do a facelift, no one would ever do a mastopexy, no one would ever do a tummy tuck. Just use the skin tightening device. Like every plastic surgeon in the world would own 10 of them because like, let's just do the thing and not put patients through surgery. They generally work on patients who don't need it. So young patients with really good skin quality, patients without a lot of stretch marks, and patients who have only a little bit of sag. Those are the patients that it's actually reasonable for because it makes a really small correction. The minute your skin's sagging, the minute you have stretch marks, the minute there's a lot of sag, it's pretty much a useless treatment that has some risks and isn't going to get you the benefit and costs money.
I 100% agree. So what else? Something that is interesting. So some patients, buccal fat removal.
That's a good one.
Your chipmunk face or, not. And so some patients really benefit and have quite an excess there. And so thinning out their lower third of their face can be very aesthetically pleasing.
And I've done them. I think, in the right patient, it's great.
Yeah. And so, but not every patient. And so, I think that there was a huge craze a few years ago about it. And so that is sort of settling out now. And there's less patients that we see that, but we do recommend it. And typically the setting is recommending it as an adjunct to other surgeries, like we did one the other week where full facial rejuvenation and actually taking out the buccal fat had a really powerful, subtle effect in concert with the whole result.
Yeah, I think that patient did great. And I do think that you bring up a really good point that usually, especially with facial aesthetics, sometimes breast and body aesthetics, doing kind of one thing sometimes isn't enough. And so when patients just say, I'm really unhappy with my look, but I only want to do this one little thing and ignore everything else, in some ways it can make you look worse because you've corrected maybe part of the problem, but you haven't addressed all the issues. And we're not saying that everyone needs like tons and tons of plastic surgery or 20 different procedures, but it is important to really assess what's causing the patients to be concerned or be unhappy, and that requires a really a detailed conversation to talk about the things that can be done, and then work with your doctor, with your surgeon, hopefully with us, to find the things that fit.
100%. We'd love to hear from you what you think is in and out.
Ooh, that was a good hook. All right, guys. Talk to you soon. Let us know. Nice.
Bye.
Bye.